Hi, good day to all. My name is Atira Bhaktia, and today I'll be giving a brief lecture on the use of calcium channel blockers in hypertension. In this lecture, we will go through the different physiological role of calcium channel, followed by understanding the mechanism of action of calcium channel and its role in hypertension, where we will also go through different classes of calcium channel with pharmacological properties, pharmacokinetics, and common adverse effects of the drugs under calcium channel blockers. So before we try to understand the role of calcium channel blockers, we will need to look at the role of calcium and calcium channel in normal physiological function. So a calcium channel is basically any channel that can allow or that will allow calcium ion influx across the plasma membrane into the cells. So why is that important? Is because calcium is involved in different cellular processes, including muscle contractions. So we have different kinds of muscle contractions, skeletal and smooth muscles, for example. And not only that, calcium is also involved in cell differentiation to form a specialized cells, including osteoblasts and adipocytes. Calcium is very important for nerve and cardiac excitability, creating action potential, which is vital for pacemaker. Neurotransmitter release also require calcium, whereby neurotransmitter would be released upon signaling of calcium from presynaptic neuron to synaptic cleft to cause excitation of neurons. Enzyme and allosteric protein modulation is also important, where it helps in releasing the hormone. And not only that, calcium is also important to upregulate gene expression, to regulate the gene. Let's now look at the definition of hypertension. What is hypertension? It's a chronic disease due to sustained or constant elevation of systemic arterial pressure, also sometimes known as arterial hypertension. So basically, a person with hypertension will have blood pressure which is higher than normal range. When do we actually consider a person to be hypertensive? Is when the systolic blood pressure is more than 140 millimeter mercury and the diastolic blood pressure of more than 90 millimeter mercury. So hypertension is a combination of cardiac output and systemic vascular resistance activity, where cardiac output or peripheral resistance are either elevated or both being elevated. It creates a pressure which is higher than the usual range, hence hypertension. Peripheral resistance, in this case, is the resistance of the arteries to the blood flow, whereby arteries becomes constricted, which therefore increase the resistance. It can be increased by both of sympathetic and RAS. What about cardiac output? The cardiac output is the volume of blood being released per minute. If we have more blood being released, it will create more pressure to the arteries. So both of them will directly impact the blood pressure. Let's now look at the diagram of the smooth muscle cells and hard muscle cells. As we know that calcium enters the cells via calcium channel, where extracellular calcium will go into the cells via voltage-gated calcium channel. So the calcium influx will activate the major contractile proteins that will drive the contraction activity. So what calcium channel blockers do in this case is that it acts by inhibiting the influx of calcium into the arterial smooth muscle cells in the case of smooth muscles, where some calcium channel blockers preferably binds to the vascular smooth muscles, while some binds to the channels in the myocardium at the sinoatrial and the atrioventricular node of the heart, also known as the myocyte. Why is intracellular calcium important for smooth muscle contraction? Because it activates the myosin light chain kinase. What intracellular calcium would do is it will actually initiate the calcium-dependent formation of cross bridges between the myosin and actin. Cross bridge cannot happen until the myosin has become activated to allow cross bridges to form. So in this case, the enzyme that phosphorylates the light chain is called MLCK, also known as MLC20 kinase. So this calcium will bind to the calmodulin, which is also protein, to form calcium calmodulin complex, which will then bind to the MLCK to activate it. So the activation of the myosin light chain kinase will then brings to the phosphorylation of the light chain myosin for the cross bridge to occur. So actin and myosin will then create the cross bridging, which will result in vasoconstriction. In this case, where calcium channel blockers is involved, it will then block the entry of calcium ion into the cells. Therefore, this contraction activity will not occur. Look at the diagram to show the impact of calcium channel blockers as a whole, where when calcium channel blockers vasodilates or causes vasodilation in the arterial bed, it will then instantly reduce the peripheral resistance. So when the peripheral resistance is lower, the afterload will also reduce. What is afterload? It is the pressure that the heart must overcome to eject the blood. So in this case, the afterload is reduced, which will then affect the blood pressure, where the pressure will then lower as well. And not only that, vasodilation will cause inhibition of coronary spasm, which is the constriction of the coronary arteries that sends the blood into the heart. Besides vasodilation activity, calcium channel blockers also inhibit the cardiac function, whereby it can reduce the cardiac contractility that can reduce the cardiac output, which will affect again the blood pressure. So low cardiac output will cause lower blood pressure. And not only that, it can also reduce the oxygen demand because of the lower contractility, which is important for angina treatment. Of the previous slide will then bring us to the understanding of calcium channel blockers, which can help it not only to reduce hypertension, but it can also help in the treatment of angina and also in arrhythmia. But as for this lecture, our focus is on treatment of hypertension. So we will look at the vascular smooth muscle contraction inhibition activity, which is created by the calcium channel blockers. So this inhibition will cause dilatation of the peripheral vascular, which causes lower peripheral vascular resistance. So that will impact in reduction of blood pressure, as seen in the reduction in blood pressure of patient taking the calcium channel blockers. Another role of calcium channel blockers is that it blocks the entry of calcium ion, which is important, a second messenger that regulates the production of aldosterone. So in this case, what calcium channel blockers would do is it stop from calcium ion entry into the cells that is important to facilitate the delivery of cholesterol to the mitochondria for the conversion to pregnenolone. So pregnenolone is a precursor for aldosterone biosynthetic pathway. In this case, when calcium ion do not enter, then the conversion will not happen. As we know, aldosterone is important for elevation of blood pressure. So the blockage of calcium entry will then prevent the vasoconstriction activity. Channel blockers are divided into two main categories, dihydropyridines and non-dihydropyridines. Dihydropyridine groups derive from molecule dihydropyridines, as you can see in the diagram, and it is used mostly to reduce the systemic resistance and arterial pressure, which has more impact on vasodilation activity. And it has less impact on heart function. It is also sometimes used for treatment of angina because of the lower oxygen supply demand, and it can be easily identified with the suffix dipine, including amlodipine, nifedipine, felodipine, nicardipine, and nimodipine. Dihydropyridines are further divided into two categories, phenylethylamine, drug name is verapamil, and benzodiazepine, drug name is diltiazem. So diltiazem can actually act on both heart and vascular cells, while verapamil acts primarily on cardiac tissues. But both of these drugs has less potency on the vasodilation, but focuses more on impacting the heart function. So it decreases the heart rate, slows down the atrioventricular node conduction, and often used for treatment of arrhythmia and angina by focusing on the intrinsic conduction system and the myocardial cells to reduce the contractility. Different drugs that are available in the Malaysian market for dihydropyridines and non-dihydropyridines. We have trade name, the original brand, and the generic brands, which are vastly or abundantly available in the market, including Adalat, Plendil, and Kalan. All of these are the original brands of the calcium channel blockers. And so we have gone through the mechanism of action of calcium channel blockers. So this is to show in another picture what will be the pharmacological action of the calcium channel blockers. So it acts on the vascular smooth muscle to reduce the contractions of the arteries and to cause vasodilation. Secondly, it acts on the myocardium to reduce the force of contractions of the heart, which is impacting in a form of negative inotropic. Thirdly, it will slow down the conduction of the electrical activity of the heart. So the low conduction activity will then slows down the heartbeat. So this is in a form of negative chronotropic. And finally, it blocks the calcium signal on the adrenal cortex cells in the form of zona glomerulosa cells earlier, which will directly reduce the aldosterone. So this aldosterone is the culprit which is causing the blood pressure elevation. So in this case, calcium channel blockers will reduce the activity of aldosterone. Hence, it will then reduce the blood pressure. So the pharmacokinetics of the calcium channel blockers are as such. So most of calcium channel blockers have high oral absorption and also high first pass metabolism, and it has a short half-life, about 3 to 8 hours following an oral dose. So you would expect that most of the calcium channel blockers will be given 3 times dosing, with exception for amlodipine with long half-life. So that's why amlodipine is often given once daily dosing. So sustained release calcium channel blockers or calcium channel blockers with long T-half will provide smoother BP control. So in this case, to control hypertension in certain patients, we tend to use amlodipine or long sustained release calcium channel blockers. For example, nifedipine XR. And some of the calcium channel blockers is also available in IV form, including nicardipine and clofazimine, verapamil and diltiazem, which is often used when oral therapy is not feasible, especially during hypertensive crisis or hypertensive emergency or urgency. So a lot of these intravenous CCBs will be used. And most calcium channel blockers have high plasma protein bound, and it is extensively distributed in the tissues, metabolized in the liver mostly, and excreted via urine. The adverse effects of calcium channel blockers are easily identified by, as you can see here, fatigue, flushing, increase in glucose level and uric acid, GI upset, gingival hyperplasia, headache, tachycardia, edema, and dizziness. So what is the most important thing that we need to identify with calcium channel blockers is that reduce in heart rate can cause syncope, where patient can have bradycardia. And not only that, calcium channel blockers causes reduction in cardiac contractility, causing low cardiac output, which impact the blood pressure. So low blood pressure will cause patient to develop hypertension. And not only that, it relaxes the vascular smooth muscle, where this will create a signal sinus to stimulate central nervous system to increase the sympathetic activity, causing reflex tachycardia in this case. Vasodilation, not only that, can increase the capillary permeability, causing the fluid to escape to the interstitial space to cause what we see here as edema, can be pedal, peripheral or facial edema, and also flushing, where sometimes the fluid can escape near the skin. And in certain calcium channel blockers, it can also cause gingival hyperplasia, including nifedipine, although the cause is slightly unknown, and GI upset, where relaxation of the smooth muscle will impact the GI motility. So GI motility is reduced because of the relaxation, which eventually leads. In summary, calcium channel blockers blocks the activity of calcium channel, preventing the entry of calcium ion into both cardiac and vascular smooth muscle cells, causing relaxation activity of both cells. There are different types of calcium channel blockers, dihydropyridines and non-dihydropyridines, which differs in the site of activity of the channel, and the side effects include fatigue, edema, dizziness, headache, and GI upset. With that, thank you so much for listening to my lecture. Have a great day ahead. Bye.